We're gonna get started. Okay, we're gonna need a few things. So I have a mobility stick. I made one out of a PVC pipe and some grip tape. On Amazon, they run pretty expensive, so you can make your own. Next, what I have is a foam roller. You can get them as cheap as 10 bucks on Amazon, okay? I also have 2 yoga blocks, okay? We're gonna use these for support. I also have a belt for stretching. You can use a regular belt. This is for yoga, but you can use any kind of strap. And I have 2 lacrosse balls. We're gonna use these just like we use the foam roller to kind of massage and use these for myofascial release. If you don't have lacrosse balls, you can use baseballs. Tennis balls will not work because they are hollow inside. So we want something that's solid, okay? And I have 2 loop elastic bands. We're gonna use these to strengthen our adductors. All right, let's get started. Okay, so first we're gonna take our stability stick, our mobility stick. We're gonna use this for support. If you don't have this in the moment, you can use just the kitchen counter. Okay, so stand up straight. We're going to draw in our core, basically pull in your stomach towards your back. Okay, so that way it activates the transverse abdominis rather than clenching your stomach down, which is the rectus abdominis. That's the superficial muscles. We want to strengthen the internal core, okay, and that's going to straighten our spine. So first, we're going to warm up with some standing leg raises. You can put your hand on your side and you're lifting your leg laterally. This is going to strengthen your glute medius, which is important for pelvic stability, okay? It's not also going to irritate your low back like kickbacks would or front leg raises, okay? We'll get to that soon. So the program I have written down 4 sets of 10. That's just kind of an average estimation, but you can do this throughout the day. And this is another good way to warm up your low back and body to allow for more mobility and the exercises to come. And also this is a great way to start because you might be starting already in a standing position in the morning and you don't want to have to get up and down and bend over, which could irritate your back further. So we're just doing 10 on each side. Try not to move too much. We want to think about stability. When we have low back pain and it's become chronic, we want stability first, okay? So we do those. Okay, next we're gonna be doing our calf raises. Similar concept. I'm starting from a standing position so I don't have to go up and down and I'm still trying to warm up my body without doing too much flexion or extension, because that right now is off limits until you get off pain. So there's a couple ways to do that. We're gonna do it with our feet straight and just normal calf raises. All the while that you're doing these 2 exercises, I want you to continue to practice drawing in your stomach, drawing in your belly button towards your back. That's gonna lengthen your spine. That's gonna strengthen the internal core muscles, what we need for lower back stability, okay? So we're just going up and down. Next, we're gonna be doing our marches. This is to activate our hip flexors and continue to warm up our body. So I want you to do this for a few minutes. Okay, next we're gonna go to the ground. We're gonna stay there for the rest of the program. We're gonna start with the McGill Big 3. This was created by Dr. Stuart McGill. He's a professor of biomechanics, and he found that these 3 exercises are best for lumbar stability. So we're gonna start with the McGill crunch. You're gonna lay on your back. You're gonna lift 1 foot off the ground and keep the other one on the ground, okay? You're gonna take your hands, you're gonna put them right under your back. Your hands are gonna serve as sensors. Now I want you to push your hands with your low back. This is gonna engage your core and strengthen the stabilizers in your low back. You're gonna hold this for upwards of 30 seconds and switch legs. Deep breaths. Focus on pushing your hands with your low back. Okay, next I want you to go to your side and perform a side plank. Level 1 can be as easy as this. Post a frame with your arm and do a side plank on the side of your legs. Level 2, you're gonna lift off from your feet. Okay, this is gonna strengthen the quadratus lumborum of your low back. You're gonna do both sides. Do it for as long as you can. Okay, the third part of the McGill Big 3 is the bird dog. We're gonna take the tabletop position. This is also known as dog. You're gonna take your right hand, make it into a fist, bring it forward, and then lift up the opposite leg. The key thing here is not to curve your low back, but to draw your belly button into your low back so that straightens out your back. And you're gonna switch. You can hold each part of it for 1 to 5 seconds. This is a contralateral exercise. Do about 10 of these. With just the McGill Big 3, you can start to increase your lumbar stability. Okay, next we're gonna sit on our sides again, and you're gonna lift your leg. So we're just repeating the first thing we did with the side laying leg raise. Again, this is gonna strengthen your gluteus medius, which is responsible for pelvic stability and external rotation of the leg. Do about 10 on both sides. Okay, take a supine position, lift up your feet, make sure your low back is nice and snug against the ground. Lift up your arms, and we're gonna do dead bug. So you're gonna extend one leg out and one in the opposite arm out, and switch. This is also a really good contralateral exercise meant to strengthen your low back. If that is too painful, I just want you to imagine that you're riding a bicycle and perform short movements. Do this for about 30 seconds to a minute. Okay, put your feet flat on the ground. We're gonna perform hip thrusts. So we're just going to lift up our pelvis and squeeze our glutes. While you're doing this, I want you to draw in your core, and that's gonna activate your transverse abdominis, like we did during the early exercises. Push the feet against the ground and relax. If you can tolerate it, I want you to do it dynamically. If you can tolerate it without pain, I want you to begin to do dynamic hip thrusts. Training the glutes are gonna be incredibly important for achieving low back stability. I want you to do about 10 reps, 4 sets, or however many you can do throughout the day. Now, if you can tolerate this without pain, I want you to do more advanced moves where you do it on one foot. So you put one foot in the middle, you lift up the other foot, and you do the exact same thing by strengthening each glute individually. Okay, next I want you to grab a yoga block. If you don't have a yoga block, you can grab a pillow or roll a towel up. We're gonna lay back on our backs with our feet up and our pelvis turned in so there is no space in our low backs. You're gonna take the yoga block or the towel, put it between your knees, and we're gonna begin our adductor squeeze exercise. This is gonna strengthen the adductors. I wanna bring in my knees as high as I can, close to my core. Make sure that the low back is flush against the ground and squeeze. I want you to do this for 10 seconds at a time. You're squeezing the block with both of your legs. This is gonna release tension from the low back. Okay, I want you to do about 4 sets of that. Okay, next, I want you to roll over into a prone position, and we're gonna try to do our planks. You can start with doing them with your forearm here. When you do your planks, I want you to protract with your shoulders and squeeze your glutes. I don't want you to collapse. We're not doing ourselves any good there, so make sure you have good structure. This is also gonna train our transverse abdominis, that inner core. Do this for as long as you can without pain. Now I want you to grab the foam roller, and we're gonna commence foam rolling. I want you to foam roll most of your body except for your low back. We're gonna start off with foam rolling our upper backs, otherwise known as the thoracic region. So lay back and move with your legs up and down. This is also gonna help with any scapular or shoulder tightness. The reason I don't want you to foam roll your low back is that can actually contribute to more pain. But by foam rolling the rest of your body, it has actually been known to help with pain distraction. Okay, that's the upper mid-back, the thoracic region. Next, I'm gonna foam roll our IT band. This might hurt a little bit, or you might feel some discomfort. Do both sides. So next, we're gonna foam roll our quadriceps. Foam rolling may help relieve pain temporarily, but it is not a long-term solution. Next, I want you to foam roll your core. This is gonna feel slightly awkward at first. That finishes up with the foam rolling. Okay, next we're gonna work on some hip mobility. So we're gonna sit back and we're gonna commence the 90-90 stretch. So start by sitting down on your sit bone, using your hands to support your weight. You're going to internally rotate and externally rotate either leg. I want you to do this for about 30 seconds, as long as you have no pain. This is going to help with hip mobility. It is also technically considered an active stretch, meaning you're stretching in movement versus passively stretching. Once that becomes easier, you do it with no hands. Okay, we go back to our sitting position and we're gonna do our butterfly stretch. This is gonna help stretch out the adductors or the groin. So using your hands to support yourself, you might be here, but I want you to just slowly allow yourself to feel the stretch. Okay, next we're gonna go with a V-sit. Just like in high school, the V-sit test, put our legs out in a V. Again, support yourself with your hands and just kind of relax, sit here. You can move your feet, kind of an active stretch. Okay, after we do that for maybe 30 seconds, we're gonna move into a pigeon stretch where we're gonna stretch out the piriformis. So almost taking this 90-90 approach, we're gonna put all our weight, shift all our weight to one side and internally rotate the other leg. Here, we're really gonna feel a stretch here, man. I want you to breathe into the stretch. I want you to start going down, taking deep breaths, and try to relax, try to feel the stretch. If that's too painful, make sure to just stay up, keep yourself posted and supported with your hands. Okay, we're gonna switch over to the other side, slowly. Okay, next I want you to grab your belt. You can use a regular belt or rope, whatever you have. You're gonna sit down, sit up straight. You put the rope around your legs. Make sure you have a good grip on it. You're gonna keep your back straight. This prop or this rope is used so I can keep my back straight and I can bring the stretch towards me and really stretch my hamstrings. If you find that you're in too much pain in this position, then I would do one leg at a time with one leg straight or slightly bent. The point of this stretch is to stretch your hamstring, okay? Tight hamstrings are gonna contribute to lumbar lordosis. So give that as much of a stretch. Take deep breaths. If you feel really tight, do the best you can.